Okay, so the assessment tool that I picked was the Hospital Depression and Anxiety Scale, also known as HADS. The Hospital Anxiety and Depression Scale was originally developed by Zygmunt and Snaith in 1983. It's published and distributed by the National Foundation for Educational Research, and it's available in over 25 languages and countries around the world. It's really extensively used. It's a great assessment tool. Administration generally takes between 2 to 5 minutes to complete. It can take up to 20 because it all depends on the patient's ability. It's a self-assessment, so it's a checklist that's given to patients that they fill out on their own. So depending on the patient's processing time, reading skills, cognitive ability, all of those good things. But generally it's just given to patients that check in to fill in with their paperwork prior to appointments. And the HADS contains 14 questions that are rated on a scale of 0 to 3, so scores can range from 0 to 21, and at a score of 8 or above, it's a sign for possible anxiety or depression that needs to be looked into further. It was originally designed for use in a medical outpatient clinical setting, but it can be used in inpatient or community settings as well. It's designed for a wide range of subgroups. It's commonly used with the geriatric population, mainly because they are one of the largest groups that suffer from anxiety and depression problems in relation to hospitalization. And as mentioned earlier, it's a self-completed assessment, so patients must be literate, and it was designed for use with patients who are at least 18 years of age. As I mentioned before, it's to identify signs of depression and or anxiety, so that you have the HADS-D and the HADS-A, and different questions on the list signify anxiety or depression. It is not to be used as a diagnostic tool. It's more of a screen, like a jumping off point, so if a patient scores an 8 or above, that's when they would be referred for further assessment. And it was designed to rule out the symptoms of conditions that are common with somatic illness. So if a patient comes in and they have overlying medical conditions, it's not just going to spit back to you that they have those problems. So things like fatigue, insomnia, and issues with those kind of disorders that often have similar symptoms to depression. The evaluation method, as I mentioned, is a self-administered questionnaire. It's used in clinical settings, and it needs to be scored by a healthcare provider. It's very dependable. The validity is moderate correlation with patients for anxiety and moderately strong for correlations with depression. Has good internal consistency for both HADS-A and HADS-D for reliability. And the sensitivity has good sensitivity and specificity for separate subscales with cutoff scale at 8 or above, as I mentioned before. So it's slightly higher for anxiety, but it's also a good indication of depression too. So pros and cons. Pros, it's quick, it's easy to do, translated in multiple languages and used in over 25 countries, as I mentioned before. It's appropriate for a wide range of people who also have other medical diagnoses possible. And it's useful in disabled or ill populations. A con is the patient has to be literate. They have to be able to fill it out themselves. So they need to have clear cognition, make sure they understand what they're reading, they can answer it clearly. And the total score was not adequately sensitive in identifying cases of psychiatric illness, so it's not always totally clear. Clinical situation. Mr. Rodriguez is a 67-year-old widower who had a hip replacement surgery about a month ago. Prior to his surgery, he was really active. He spent a lot of time outside. He liked to golf. He liked to garden. But post-surgery, he's markedly more quiet. He's a lot more disengaged, and the clinicians have picked up on this in their conversations with him. His occupational therapist noticed the change in his demeanor and had him fill out the hospital anxiety and depression scale. He scored a 10, which, as I mentioned before, the cutoff point is an 8, so that was an indicator that he may suffer from anxiety and or depression. He was particularly high on questions related to his ability to get a good night's sleep. There were questions such as, I feel a loss of interest in my daily life, things like that, and he scored especially high on those, which are indicators of depression especially. And so Mr. Rodriguez was referred to a psychiatrist for further testing. Here's a picture of the Anxiety and Depression Scale Manual, and then over here are the actual individual questions. Oh, nope, not going to clear up. But as I mentioned before, there are questions regarding I still enjoy the things I used to do, You answer definitely as much, not quite as much, only a little, or hardly at all. So different ratings like that give you the different scores, and then if you score, like I said, 1,000,000 times an 8 or higher, that's indicative of possible anxiety or depression. Here are my sources. Thank you very much.